I was asked to talk about obsessive compulsive disorder. Okay, so there are sort of three categories of obsessive compulsive issues. One is what many people have, and that is just in general they like to have things orderly or organized or in a straight row, or they like to make sure that the frames of the pictures are level and not crooked, and it's a minor thing, and they make these adjustments, and they kind of like to have things that way, and this is just kind of normal. Okay, it doesn't cause any discomfort, doesn't cause an excessive amount of time, usage of time. Okay, then there's the obsessive compulsive disorder personality type, personality disorder, and then there's like the axis one, as they say, full-blown obsessive compulsive disorder. The obsessive compulsive personality disorder is basically people who really, want to be incredibly, organized and structured and everything in its proper place, and really they are much more meticulous, they are much more kind of closed-minded to other ideas, much more inflexible. They want things a certain way, or else they just don't feel comfortable, they don't feel good about it. Now, for the most part, this is not debilitating, though. It's just kind of a personality trait, a characteristic, a behavior that some people may find annoying, some people learn to tolerate, whatever, but for the most part, it doesn't get in the way of these people being very high functioning and getting there and having very effective lives. Okay, but the OCD, the obsessive compulsive disorder, like the main event, that can be very disruptive of people's lives. That can be very upsetting. That can take up a massive amount of time and debilitate people. In some cases, prevent them from being able to leave the house. Because some people actually have a fear that they haven't locked the door. So they have this checking. And so they lock their door, they get in their car, and they go, wait a second, did I lock the door? Well, I know I did, but what? Maybe I'm not remember. Did I? And they got to go check. And so they get out of their car, they check. Oh yeah, it's locked. Okay, good. They get in the car. Yeah, but I'm not. I don't know. So it's crazy, right? In a way, I shouldn't use the word crazy, but right. It's irrational. It doesn't make any sense. They just checked it. They should be able to reassure themselves and say, I just checked it. It's fine. But that reassurance doesn't work. For many of these people, they must check 3, 4, 5, 6, 7 times. Sometimes it can take an hour for them to get out of the house to go to work or to drive somewhere because of this constant checking. People do that with burners in their house, checking the locks and windows at night before they go to sleep. And of course, there's excessive hand washing, where people are worried about germs and contamination, and they're excessively washing their hands over and over and over and over again. And it can be like an hour or two, or someone takes massive numbers of showers, a half hour, hour at a time, several a day. This is very disruptive. It's not fun. And see, the thing is, if they try to stop it, if they try to not do the ritual, not do the obsession or the compulsion, it creates a tremendous amount of anxiety, so that it's like they can't not do it. They've got to do it to reduce their anxiety, so they've got to do these rituals. Sometimes it's counting. They've got to count, they've got to count three times before they can do something. They got to chew 6 times, or they're always counting to see, as they're driving down the street, how many cars are over there, or how many blue cars, green cars. Numbers, counting, obsessive thoughts is incredibly difficult to live with, where you just can't get thoughts out of your head that over and over. You keep repeating and ruminating and these thoughts, and they don't go away, and it's really disruptive. Okay, so it's rough. Now, medicine can help, but so can cognitive therapy, talk therapy, cognitive therapy. Changing your mind can be just as effective as medications. The main idea to keep in mind is that the reason what happens is, in my formulation, is that obsessive compulsive behavior is a desire to control, in a way, is a desire to control the universe, the desire to control everything. If you have everything in its proper place, if you anticipate everything, if everything is done exactly the same way with certain rituals, you're never going to get hurt. Nothing bad's ever going to happen. That's kind of the idea that so you got to do all this stuff in order to stop really scary things from happening. Okay, so it really comes down to Yeah, so it really comes down to an irrational, incredible discomfort and anxiety, and an irrational belief that something terrible will happen unless you do something. Okay, so what's the solution? How can you talk yourself out of it? That's what you want to do. If you're not going to use medicine, or even in conjunction with medicine, what you need to do is talk yourself out of it. You've got to override your fear, override your anxiety, and remind yourself of what is true. Okay, so you think about it. If you think you have to, like, you know, there's a number that you have to count like to 3 before you swallow, or else you're going to choke. You gotta go, time out. Wait a second. What's the evidence or data of that? No, that's a superstition. That's an irrational thought. It's not real. It has no power. It can't ever have any power. It only has the power to paralyze me because I give it that power. And so there's a tremendous urge, right? That anxiety. No, but I gotta count to 3 anyway. Well, you've got to try to fight that and challenge that and say, no, I'm not going to do it. You resist. And resist as long as you possibly can. And if you have to give in, you give in. But if you resist, fully and long enough, perhaps it'll occur to you that the sky didn't fall in. Nothing terrible happened. You didn't wash your hands 12 times. You washed them only 8 times, and nothing bad happened. You didn't come down with the plague. You're okay. If you've got like a frame on the wall, a picture on the wall, and it's crooked, and you have the urge to fix it, and it just makes you so uncomfortable, it has something to do with what will other people think. It's making you uncomfortable. Tell yourself, so what? Right? It's uneven. Why am I anxious? What does this mean? Okay, so somehow we think that, well, we want to control the universe, we want to make it safe and predictable, so somehow if we fix the frame so it's steady, that will make us safe. Well, of course it's not. Moving the frame or not moving the frame does nothing to the universe. It doesn't increase your safety. It doesn't increase your health or well-being. It's just a waste of your time. Well, it's not a waste of time to fix the thing if you like it aesthetically pleasing to be straight. But all I'm saying is there's no unintended consequence, really, for the most part, of having a frame that's not even. So that's how you overcome this stuff. You have to continually remind yourself to resist. That's how I believe it can be done. Resist the need to do the compulsion. If you have an obsessive thought or whatever, try to distract your mind. Put your attention deeply and intently into something else. When the compulsion when the obsessive thought comes back in, go, no, not going to go there. Go back. Put all your energy, your focus, your attention on some other thing. Just keep working it. The more you insist on, I'm not going to give in to obsessive thoughts, I'm not going to give in to compulsive behaviors, you are sending, it's not easy this is like brutally hard, perhaps one of the most difficult things to do. But you can distract your mind. You can get yourself off of these, being stuck on obsessions and compulsions. It's really difficult, but if you just stick with it, you'll be sending a message to your subconscious mind that you don't want these rituals and compulsions and obsessions. You don't want them. You don't need them. They're not real. They are a mind game. You don't need to fall for it. Nothing terrible is going to happen if you don't do this. You check the lock 6 times. It's time to go to work now. Maybe you do a successive approximations. Let's say you have to check the lock 8 times every day. Okay, make a deal with yourself. Let's do it 7 times every day for a week. And then we'll do it 6 times every day for a week. And 5 times. So you're tapering yourself down like you would medicine. And you'd be comfortable at each lower level, and perhaps the anxiety gets less and less. But the point is, you're in charge. You are not a victim of your mind. It feels that way. With OCD, it really feels that way. But the bottom line is, you have control. You can override your subconscious. You can override these obsessions and compulsions. You just have to insist on reminding yourself of what is true. And what's true is that all of these obsessions and compulsions don't mean a thing. It's a mind game. It's tomfoolery. It's you tricking yourself. It's your subconscious playing a game. There is no threat. You are safe. You're as safe as anybody else for the most part in the universe. Okay, so there's no threat by if you don't like count to 6 before swallowing a pill, or getting in your car. None of the you don't have to step between the cracks. It's all you can do it. You can do it. Now, what I would advise, if you have got a really severe case of OCD, you might want to start with some medicine, and then the medicine will give you kind of a leg up to control this stuff. And as you get more mind control, maybe you back off the medicine. But if it's possible to not use medicine at all, I would encourage you not to do that, because they are chemicals. They are not natural to the body. They can be potentially very toxic. Anyway, so that's it, I guess. That's sort of an overview of OCD. I hope it has helped.